Thank you so much, everyone. Today we gather on this evening to have something light and something to be discussing on the health which we see in our common day-to-day life, and something which you will come across very frequently, especially with so much of a healthcare system now available in our hands and a lot of primary health checkups that are being done. So in this series, basically, see, when we talk of a gut health, it is not one single topic that we can deal with. It's plenty of plenty of material in that. So today, in as a series or in this, I'll be dealing with fatty liver, something which is commonly we see in our practice, and something which commonly patients get to know and ask, what is it? What is fatty liver, and do I need a treatment for that? What should I do about that? So we'll just learn that a bit today. So what is a fatty liver? Basically, a fatty liver, or the other word is steatosis, is defined as a condition where more than 4 to 5% of the liver weight is fat. So it's not actually that entire liver is replaced by fat. That is what we call as fatty liver. When 4 to 5% of the liver weight is fat, we call it as a fatty liver. Now, whenever this happens, basically there is deposition of triglycerides, which we do on our lipid profile, right? The triglycerides get developed within the hepatocyte. These are at the cellular level. That leads to inflammation out there, which we term as steatohepatitis. Okay. Now, the problem with this is subsequently it can go on to liver cirrhosis and development of hepatocellular carcinoma. What turns out to be, previously they used to say that just liver enlargement. Now we need to justify and define it as grade 1, grade 2, grade 3 liver enlargement. We'll come to that subsequently. Okay. Now, you know there are two forms of fatty liver disease. What we do, one is based on because of the consumption of alcohol, which is commonly called as alcoholic fatty liver disease. The mechanism is almost the same, and the more dangerous one, the more common one, if you ask me, is the non-alcoholic fatty liver disease, which we also known as NAFLD in the short form, which is related similarly to the insulin resistant and in the part of the metabolic syndrome. Okay. Now, it has shown that a patient with the NAFLD has a higher risk for cardiovascular disease and atherosclerosis, and it is an independent factor from other features of metabolic syndrome. So, like, whenever we talk of a cardiovascular disease, we talk of high blood pressure, high diabetes, uncontrolled diabetes, we talk of lipid profile, but NAFLD, that is non-alcoholic liver fatty liver disease, is also an independent risk factor for the cardiovascular disease. Now, if we ask, the prevalence, which that is, how it is, it's become an epidemic. Epidemic means if you see with the change in lifestyle, betterment of lifestyle, we are seeing a big epidemic of fatty liver disease, and the prevalence in India is actually, involving nearly 53% of the population, though it ranges from states to states from 9 to 53. That's because our recording is quite low, but still it's a huge, huge, huge burden on the healthcare system and can negatively impact the limited source. The good news is, it can be controlled and it can be, taken in the right way ahead. Now, if you see the prevalence compared to the Western lifestyle, Indians are less commonly affected, but this is trend is changing, and now Indians have also been equally affected. Now, there are two types, in this grossly in NAFLD. One is NAFL, where there is a simple deposition of liver fat in the liver cells, but there is no inflammation or there's minimal damage. It does not progress. It's an early stage. We can get back to it. Then there is the non-alcoholic steatohepatitis, where because of the deposition of fat, there is liver cell damage, and this progresses to further on, and we need to be more careful about this. Okay, how it goes is, so you have this NAFL or a NASH, and then it progress, like I said, early stage, fibrotic stage, and fibrotic F2 fibrosis stage, and finally cirrhosis, and then goes on to the hepatocellular carcinoma. Okay. So again, normal, you have non-NASH, then you have NASH, and you have NASH with fibrosis, grade 1, grade 2, grade 3, grade 4. It goes to advanced fibrosis, cirrhosis, or a hepatocellular carcinoma. And the common cause of death is quite early on at the level of NASH itself. And what are the outcomes of NAFLD? Like I told you, why do we need to know? Is it only because of the liver that we need to know, or there are other factors also associated with it? To be very honest, if you see NAFLD in a person, which is one of the most common thing which while ultrasound we can get to know, you can also be assured of the other things which can be happening in them. So there is osteoarthritis, there is cardiovascular diseases, there is diseases due to in the brain like ischemia, strokes, you have diseases at the level of ovary cancer, obstructive sleep apnea, gallstone disease, diabetes, and sarcopenia, that is muscle loss. So NAFLD is associated with a lot of factors, a lot of multisystemic disorders. So we need to be very, very, very careful for that. What causes NAFLD? Why should we get it? So most common reason why you get is because of obesity. Obesity means basically you're eating more than that you actually require, and your consumption, your activity is there. And there is high blood pressure at some factor. There is low HDL cholesterol or hyperlipidemia, and there is definitely insulin resistance, that is pre-diabetes or diabetes. These are the various independent causes of NAFLD. So we need to be taking care of this at a very, very, very early stage. Now, why this happens? What happens is whenever there's fat deposited in the liver, it can cause an oxidative stress. There can be cytokines or toxic inflammatory protein release which can damage the liver cells. Apoptosis is a self-induced liver cell necrosis of the body, and there can be WBCs that invade this tissue and causes inflammation, or it can be a gut microbiota which actually act upon these fats which are deposited and cause the inflammation resulting in the loss of liver functioning and all. So how do these people present as? Very, very vague symptoms, very difficult for us to analyze and attribute it to fatty liver. The commonest symptom that they come out with is fatigue, tiredness. Almost always we see overweight. There is abdominal or GI stomach pain, discomfort, dyspepsia. There are sleeping problems, they don't get sleep. There is weakness, there is feeling lethargic, there is stress, there is difficulties in concentrating, there is nausea, there is muscle cramps, there's depression, there's anxiety, there is pain, there's itching in the body, loss of appetite. There can be clammy, red, sweaty palms, spider-like blood vessels, dermatological issues with skin lesions, flu-like symptoms like low-grade fever, especially in the evening. And I know some people who have no symptoms and just on ultrasound we get to know. What I want to say in this slide, to be very honest with you, is there is no one particular symptom which is classical of fatty liver disease. So invariably, it's all the vague symptoms that they present as that needs to be attributed and that needs to be worked towards that. So in case if you're not getting any of this, let's say if you've done some blood tests and you're not getting anything conclusively, we can go back to an ultrasound and get it done. How do we diagnose? Like I said, first and foremost, when a patient comes to you, there's a high level of clinical suspicion. The patient is overweight or obese, you can get to know straight of fact their BMI is more than 25, and that is one of the reasons why they get it. There's a definite family history, either their father or mother or their relatives have suffered from a fatty liver disease. The blood pressure of the patient is quite high. The blood investigations which I have done shows a deranged lipid profile and high sugar levels. So this can also attribute. And then the most common method is an ultrasound, which we do, or a CT scan that can help. A fibroscan, which is normal from 2 to 6, more than 8 is indicative of a fatty liver, has more a prognostic value than a diagnostic value. In the sense, let's say it's 8 now and 3 months later it is about 12. That means your disease is progressing. You need to take care of it and ensure that the subsequent fibroscan which you shows is less than what the previous value is. That is where it has an advantage. Liver biopsy is the ultimate test that will say for sure whether you have fatty liver disease or not and how bad the effect is, whether there is any cirrhosis or a cancer associated. So treatment wise, now everybody they have come with vague symptoms, they've got an ultrasound showing a fatty liver. Now they're like, how do we treat this, doctor? How do we go about it? The first and foremost answer is, though you'll be given a lot of medicine which are like liver tonics, liver multivitamins and all, you don't need any of them. There is no effective medical intervention at all in this case. The thing which is most required is a lifestyle changes. In lifestyle changes, you have dietary modifications, you need weight loss, and the role of surgery, that is in terms of bariatric surgery, especially if you're obese, to reverse the effect. The bariatric surgery is one of the best outcomes of it. Otherwise, there is no medical, no medicines, no surgery involved in this at all. So once you have a weight loss, the fat deposition in the liver also gets down, and you have the mobilization of fat outside the liver. That helps. Now you make specific change to your diet, which I'll come to you subsequently, and a regular exercise. Okay. Now, we do give, some medications, especially if, like, say, you have to keep your sugar in control, you have to keep your blood pressure in control, you have to keep your lipid profile in control. So we need to give you the medications for that to ensure that, don't progress on any further. Now, when we talk of a weight loss, you won't even believe just a 5 to 10% weight loss is ideal to reverse the effects of non-alcohol fatty liver disease. Okay, just making changes into the diet alone has a positive effect in the liver. So it is important to refrain from drinking, obviously, which can cause more harm to the liver in case you are not. Avoid smoking and alcohol. Participate in regular exercise, which is the key. Eat a healthy, balanced diet. Have a good blood sugar control, especially if you have diabetes. Treat high blood pressure and high cholesterol. That will help. Now, what we follow and what I recommend for my patient is a Mediterranean diet pyramid. Now, in this, the first and more foremost, what we suggest is be physically active. Enjoy meal with others, do a physical activity, group activity, that will help. What you need to eat in bulk is fresh fruits, vegetables, grain, mostly wheat, whole wheat, olive oil, beans, nuts, legumes and seeds, herbs and spices. Avoid maida or the refined flour-based food. Drink adequate water. You can have fish and seafood, which are quite nice. Now, again, having this food to ensure that you're having in a proper way, no fried, no filled with fat. Preferably go for grilled or smoked or steamed food. That is much more effective. What you have little lesser is the poultry and eggs, cheese, yogurt. This is also important. And along with that, cut down on alcohol. And what you should have least, okay, is meats, okay, and sweets. Okay, when you talk of red meat, that comes in the last category, and any sweet, any sugary food is not good for you. Eat a balanced plate. Okay. Now, when you have a balanced plate, what do you mean by a balanced plate? Balanced plate has half filled with colorful veggies. You have plenty of veggies that you can think of. You can fill it with half, and half a quarter plate is with carbohydrates, whether you want to have rice, whether you want to have roti, and then half should be lean protein. It can be, eggs, it can be chicken, it can be fish, it can be a little bit of meat, or for vegetarians we can have paneer, or we can have tofu. These are all, much more. All you can have a bowl of dal, so palak. These are all a good source of lean protein. So legumes. So this is how we go about keeping a balanced plate. Exercise, like I told you, how much is correct for you. What I suggest is 30 minutes of activity 5 times per week, and slowly increasing to about 45 minutes daily. That helps it. So at least walk, for those people who cannot do because of other issues, cannot, at least walk should be there. And that, do not count household activities or your work to your workplace or exercise on the way as a part of this. It has no meaning. Okay. And in case you have any issues with the heart or any other organ, please consult your doctor before you need that. Okay. What is also suggested is to go for group activities. Group activities has a thing that you will not feel, out, or you'll always be motivated. You have people around you doing that. So that helps it. And then strength training, and especially muscle strength training, is very, 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 very important. That also helps a lot. That keeps you going. Just to brief you out of what topic we call, now this is one of the NAFLD is one of the commonest thing that we see in day-to-day life. You must remember that is a progressive disease and it is a multisystemic disease. You need to take care of it right from the start. It's one of the most common cause of liver disease in the world, and it has definite impact on growing clinical, economic, and quality of life. What is more important for you to is understand that early fatty liver, that says you are likely to get many other diseases. You don't need these days need to do lot of genetic testing, or and some other testing, high grade testing, just to see whether you'll be getting a new disease or not. Your lifestyle, whether it's good or not, can be one detected by one simple thing. To be very honest with you, that is a non-alcoholic fatty liver disease. If you have it, please, please, please do change your lifestyle and go about it. That would all be today. Okay, I wish you all the best. Thank you for a patient listening. If you have questions, we can go with it ahead. I don't want to burden you with long, lengthy topics and all, but for you to understand what is good for you, what is right for you. So most of the time, if you are on the overweight category, rest assured you will be having a fatty liver disease. Take care of it right way so that it doesn't cause you much issues. Thank you. I can have questions if you have it. Okay. So we have Priyansha Gaur who's saying gut healthy and gut healing food for vegetarians. Like I told you, vegetarians do have, a lot of factors, and to be very honest, vegetarians have the best factors in them. What I suggest is green leafy vegetables and fruits, especially colored. You can think of, different types of, all colored, like let's say turnips, let's say beetroot, let's say they're not just not a big green leaf, let's say capsicums. You have different, these are good for your health, and that helps in digestion, and that helps in a good gut health. To improve gut health and digestion, to be very honest, let me be very practical with you, Kuldeep, that you need to ensure that you're not having any toxic food. Okay, toxic food in the sense, right from alcohol, right from smoking, right from eating smoked charry foods, right from having maida, refined plate, those food, right from having spicy food. Avoid this. Beverages limit to 3 to 4, and do not go overboard with alcohol. Once in a while is fine. Otherwise, if you can restrain from it, better good. Have a stressless life. Eat plenty of vegetables. Drink good amount of water. Drink. I mean, eat plenty of fruits. This will help you. Do not keep yourself on an empty stomach, and that is how it will be better off. Okay. So the question is, Bhavesh is asking, especially if you're traveling, how to improve your gut health. Now, Bhavesh, first and foremost is for you an understanding what is good, what is not. Okay. If you're traveling, try to go the traditional way, local food, which will definitely be a healthy point. What happens is we tend to overeat, especially when we are staying in hotels and all. Know what is right for you. Go for some vegetable salads, everything. Have one carbohydrate meal. Avoid fruit, sweets as much as possible. Avoid coke, diet, everything as much as possible. Stick to water. That helps a lot. That is the only way, hold on. Try traditional food. That is what I tell most of my patients. Because traditional food still will be good. How to deal with improper bowel movements, repeated mouth ulcer, red circle, white center with lots of pain and burning sensation in palm and sole. Now you must understand something. What is inside and what is outside. What is outside is a reflection of what is inside. So if your inside is burning, your outside will also burn. So all you need to do is take care of it. Just to show your repeated mouth ulcer, I would advise you to visit a doctor and show it. But if you ask me, sticking to the healthy way, which I've told you, should help you a while. I always tell my patients, GI system is like temple of the body, right? When you have a temple in the home, you don't wear your slippers, chappals, everything and go inside. You keep your temple clean, neat and clean, right? Same thing should happen with your GI system. Keep it neat and clean. Don't get it down with dust, everything. You will do just fine. Your bowel habits is a reflection of what you eat. So if that food doesn't suit you, avoid. It can never be there that you're not, suited to any kind of food. Gluten allergy or any allergy, these are all just part of it. So you need to know what suits you, what doesn't suit you. There are plenty of other healthy options, so stick to that. So the question here is, how do we know the sensation of hunger is genuine, or if it's a time-dependent one? Is there any healthy hazard ignoring it? Let me answer you, Sumesh, this question in a different way. Okay. Now, my whole point, and I tell my patient is, why should you get hungry, right? What I suggest my patients is small spaced out meals. I want you to eat every 3 hours, irrespective of the fact that you're hungry or not. Okay, it's 8 o'clock in the morning, it's time for me to have something. It's 11 o'clock in the morning, it's time for me to have something. Don't say, jab bhook lagega tab hum kha lenge. Yeah, that means when you're hungry, you're going to eat food. That's not the right way, because hunger is a dire situation of the body which makes it, go in a negative way. Don't reach to that state. Let's say you're busy in some work or something which, is taking you more than 3 hours. Prepare in advance, have something light, keep yourself good, and in between, maybe when you're taking a break for a loo or something, you can just munch in some dry fruits or nuts. In a meeting, if you are, you can go for a green tea and have some, one or two biscuits or something like that to ensure that you're not hungry. So it is time dependent. At the same time, you have to eat short spaced meals. That will help you, and do not ignore it. So now again, Manoj, who was asking how to improve digestion and get rid of stomach issues. I've explained all these factors. If you follow this, I'm sure your digestion will improve, and you'll be getting rid of it. Now, how gut health keep our skin glow? Any tips for skin glow on through gut health? One of the commonest thing which is very much misunderstood is amount of water to be drunk. Now, any person who is otherwise having a sedentary lifestyle should drink about 2.5 to 3 liters per day. Any person who is into sports activity should nearly drink 4 liters of water per day. And what happens is you'll be drinking 1 liter in the morning, 1 liter in the afternoon, 1 liter in the evening has no meaning. Your water intake should be throughout the day. That is the single most factor which I would say is good for him. We don't tend to eat that, especially if you're working in AC offices and all. We feel that we have to pass a lot of urine, so we don't drink water. But I would suggest is, drink. So how I manage is being a surgeon and busy in my work. I have 2 glasses of water, about 100 to 200 ml, 2 glasses before surgery and 2 glasses after surgery. Maybe I'm still working in AC, but still there are, some incoherent loss in the body, which is happening, insensible losses, which you don't realize. So that is why water intake is good. Second, vegetables and fruits. These are the food for your skin. Totally. Don't ignore them. Now, how to strengthen good bacteria in gut and how to manage irritable bowel syndrome. It's irritable bowel syndrome is more of a medical. It's very difficult for me to explain the entire chapter in one question. I'll answer how to strengthen good bacteria in gut. Having curd is one of the best and easiest made, especially Indian diet is filled with them. You can try things stuff like Yakult, or if you still feel you don't like any of this, you can have probiotics. But the only way you strengthen good bacteria in gut is to ensure that bad bacteria is not there in the gut with the bad food. Why do I have bad food? It's more, food which are not healthy, which are not cooked, which are not, kept clean in a neat way, and food which you don't trust, especially salads in an open area. Just avoid these. That way you'll be fine. Irritable bowel syndrome is a very big topic, and it's a big textbook topic in itself. Maybe sometime when we sit down, we could talk it separately. I will not include in this point of time. How can a vegan diet help in building a good gut microbe? See, when we talk of a vegan diet, we think of more of fruits, vegetables, which I already told you, which is helpful. You don't go for some dairy products, or maybe you're a lactose intolerant and all. But these diets are other extreme forms also which are there. See, whether you are a vegan or not, whether you are a non-vegetarian, vegetarian otherwise, or vegetarian, whatever it is, you need to ensure that in your diet you should have a good amount of vegetables and fruits. That is the one which will take you through and good with it. Okay. Now, question is increased belly fat a bad on gut health? Yes, definitely. When we talk of belly health, there are two types of fat. One is a visceral fat and one is abdominal layer fat. So abdominal layer fat is a fat which is accumulated above your muscle level, just beneath your skin. Basically, fat gets accumulated beneath the skin as a part of insulation. So this fat will not cause so much harm. But the visceral fat is the fat next to the gut, or which is like you have a lot of fat inside, including fatty liver and all. This is it is a bad indicator of diseases that are come forward. This causes a lot of insulin resistance, they causes a lot of otherwise health problem, gut motility, everything. So you should be ensuring that the visceral fat is less. In Asian population, the visceral fat is more compared to the abdominal belly fat. That is not a good sign. In Western population, they have a better more abdominal fat than the visceral fat. That is why they tend to do little better. So what is the optimal amount of protein an adult needs to have in on average? So the optimal protein that one needs to have is, they say, 1 gram per kg per body weight. So let's say you are weighing 60 kg, you need to have 60 grams of proteins per day. If you're weighing 80, we would recommend you 80 grams of protein per day. If you're working out or muscle building, So if you are a 60 kg individual, you can go for 70 to 80 grams as well to help build your muscles. So this can be got through vegetarian and non-vegetarian food. You don't need to get into a protein powder for the same. So what are the commonest cause of IBS? So let me put you, since you're already asking twice, the whole chapter, I'll just tell you something. Whenever irritable bowel is concerned, you must understand that your bowel is not ready to take that food and get it irritated with that. Now, every individual should know what is right for him and should eat accordingly. See, let's say if I'm allergic to or I have some problems after I take roti, why should I take roti? I can have something else that suits me. Doesn't mean that not having roti is the end of life. It just means you cannot have it. Finish, get done over with it, and understand that okay, fine, I cannot have it. It's fair enough. Let me compensate with something else. Multigrain, millets, I can go, I can see. If not else, I can turn to rice. If rice helps me, fair enough. It doesn't help, then I stick to the other stuff. So you have plenty of options to go about it. What I always say my patients is don't think you're a glucose intolerance, lactose intolerance, you are not having, gluten. So what you need to understand is what suits your body, what doesn't suit your body. What doesn't suit your body, take it out. A lot of people cannot have a lot of things. So that doesn't mean they're abnormal. It just means their system is like that. Appreciate your system. That is how you will go well with that. Now, in a diabetic patient, what you need to understand is they need to keep their sugars under control. So again, the same thing. The problem with diabetics, what happens is the fruits, the amount of fruits they can eat because fruit contains fructose in the easiest form of sugar. So that's not really great. So what I suggest is in diabetics, if that especially they are under uncontrolled diabetes, what one fruit per day will do no harm. Choose your fruit wisely and go about it. I would always recommend to go for local fruits than get somewhere else. Like what is locally grown. If apple is grown locally out in your place, have it. Okay, don't have to import apple to have it, right? So what is grown locally is will be always good for you. So vegetables good, fruit just one fruit per day, that is good. Exercise, that is also one of the key ways, especially in diabetics, to improve gut health because exercise causes good blood flow. Now, whenever there's a good blood flow into the system, you have a great cleansing of the bowel system. That is all. Okay. Now, to check gut health, do you have any specific test? Okay. And second is amla juice helpful for gut health? Now, let me be very honest with you. There is no specific test to actually say your gut is good or not. If your gut is not in good health, you will have symptoms, pain in the abdomen, loose stools, vomiting, nausea, uncomfortable feeling. When you have food, bloating, all this. So you will have. So based on what symptom you present with, we can think of a test like ultrasound, CT, colonoscopy, upper GI endoscopy. These are even in blood we do TTG. So these are different tests which we do, but depends on what is that. Is amla juice helpful for gut? I would honestly say eat amla. That's much better than drinking amla juice, which also has a lot of ingredients other than the proper juice in it. So eat amla. That's good for your health, anyways. So Naveen Kumar asked me a question that he has recently undergone a stone operation on the left side kidney. There are stone in the right side as well. Should I go for an operation or these can be read? No, it's anyway out of context in this. But just to help you, you need to visit a urologist and decide based on the size and the location and if there is any obstruction present. That is how we go with it in this management of that. What are the poor indicators of gut health? So poor indicators of gut, the simple one thing, poor health otherwise. That is the poorest indicator of gut. Like I told you, GI system is the powerhouse of the body. So let's say you have a car. Okay, unless you have a good engine, your car is not going to perform well. You with a smaller engine or with the engine which is not good, you can do only so much. So unless you have a good engine and the condition of the engine is good, your car cannot perform. Similarly is GIT system. So gut needs to have a good value to have a good performance. So indicators of poor gut is poor health. How to make digestion strong? The only way your digestion system is built very good. You don't have to be thinking anything about it. You don't need to take anything extra to ensure that you need to get your digestion strong. If you don't abuse it, trust me, your digestive system will be beside it. Problem with us is we abuse the system. And then we expect the abuse system to perform well and do wonders for you. That is one reason we have a failure, in terms of a digestion. So only ensure that you don't abuse it. You ensure that you work hand in hand. you will definitely have good outcomes. How do we identify which food item suits our gut while what doesn't? The only way we can identify is first knowing what it is, how it is, and stuff like that, and then going about to try it. If it is good, let's say you have finger chips, or you have French fries in front of you. You know that for sure that that food is not great, and that food is not going to give you any effect, right? It's not going to help you. It's not going to be of any use to you. Why do you want to even try it? On the contrary, let's say green leafy vegetables are there. They are good for your body. Try it out if it suits or not. If it not suits you, you will get to know anyways. So you will not have to worry about it. So now diet to cure uric acid issues. So basically in uric acid, we just say go less on processed foods. One of the commonest cause of uric acid increase is the processed food, red meats. These are the commonest causes. Drink plenty of water. So that would be the best. If it is on the higher side, you definitely would, and you are symptomatic, you would definitely need medications for that. The third question is how do we, deal with acid reflexes? You must understand few things that, acid reflux is not quite common. One of the reasons why you get acid reflux is because of not proper eating the diet. So you follow all the principles that you need to have. Despite, you being on a healthy diet, healthy lifestyle, good exercise, everything, if you still get acid reflexes, you need medical treatment. You don't need a medical treatment when you're abusing it. Come out of abuse, have a routine, normal lifestyle. And if you still feel you have problems with that acid reflux, consult a doctor. I don't have a gallbladder, and so I get acidic very fast. How can I manage my diet having a better get health? Let me be very honest with you. Gallbladder, having a gallbladder or not is no indication of getting acidic very fast. So gallbladder indirectly has a role in the stomach acidity. And yes, gallstone disease present with acidity, dyspepsia, everything. But that is not the only reason. There are thousands of other reasons where which the acidity increases. What I suggest for you, definitely consult your doctor, whoever, and get to know why you're getting acidic very fast. Is your lifestyle a problem? Is your dietary habits a problem? Is the medications you're taking a problem? So you ensure that you are in the right hand with the proper diet so that you don't have an issue with respect to that. Neha, what I recommend you is to meet a doctor and see what is the issue. So, I do gallbladder surgery. So I tell my patient just because your gallbladder is removed, that doesn't mean you will not be acidic throughout your lifestyle. That, I mean, lifetime. What it just means is the factors or the problems which are related to the gallstones are taken care of, but you still have to lead a very normal, healthy lifestyle for you to have good results. Rahul has asked me, how does abdominal fat impact our internal organs functioning and how to reduce its impact? So let's say, see, presence of abdominal fat is an indicator indirectly of obesity or overweight. Now, what happens is it takes the place of, the normal cells, like it gets deposited in the liver, reduces the liver cells. It gets deposited in the pancreas, reduces pancreatic cells. So let's say you're working in an office, right? And in your office, if you load people with useless things who are coming and taking your place, and these people don't do any work, cause more nuisance out there, your work is going to suffer. Similar is the work of the organs. They are also going to suffer. Now, when we talk of intestine, the intestine is a very mobile organ. It will be there in one place today, it will be there in the other place. It keeps moving. Let's say something which is moving, you put a load on it by increase it by another 1 kilogram of something. The strain increases, so the performance also decreases. So that is how indirectly it happens. And certain foremost thing, insulin resistance. The more the fat in the body, the more the resistance of the insulin. That definitely has an indirect impact. Your weight increases, and that indirectly causes more issues with that. So another question which Baby Rawat is asking: what age we start more issues and good? The issues on gut starts right from the time you're born. So right from the time you're born, if you're not having a good diet, you can get issues. We get kids pediatric age group with constipation, with hemorrhoids, with gallstones. It's increasing. It's increasing because of the change of lifestyle and the change of. Now, Shreya wants to know, how do we know good and bad bacteria count? Bad bacteria count, you will know with infections, fever, loose motions, everything. Good bacteria count, we can do stool test, but it's not going to, be of any use for you. just knowing what if is good or bad bacteria is there. All you need to do is continue. If you're having problems like stomach ache, loose motions and all, that means there is some problem. You can get your stool tested, and then depending accordingly, you can take the medications. Otherwise, if you just want to know for the sake of knowing, there's no point. Still continue with your lifestyle, and that will help you. Where can we look for the recording of the session? That will be held by the coordinator of the session. So I'm not too sure about that, but I hear it is there on the YouTube as well. How to maintain good gut issues for kids and adults, any food habits. Like I told you, how the Mediterranean diet, which I told you, everything is a part of it. It's not only about eating, it's about other lifestyle also, including exercise, healthy lifestyle practice and all. What is important for us as an adults is to ensure that we inculcate the same things for kids. Kids, trust me, learn by examples. They don't, these kids these days, they don't, get to the fact that we want to eat that, we want to eat healthy. If you are cooking healthy at home and you're not cooking anything, and inculcate this habit right from day one. Don't wait for the kids to grow saying ab to chota, abhi to khila do, abhi to chocolate de do, abhi to. No, I'm not saying absolutely take it out from their food. You can have it once in a while, but they should know it's only once in a while. It's not every day. Junk food is not every day. The more you try to refrain them or more you fight it out with them, it's going to be a problem. So get into an understanding with them, get into know them ki what is right for them, what is wrong for them, and then they need to act it accordingly. Trust me, when you take kids as friends and discuss with them, that's a more effective way rather than getting into an argument with them. It makes no sense. Why has the overall gut of the health deteriorated? Abba, I completely agree with you. You're absolutely right saying this. The reason why overall the gut of health deteriorated is the lifestyle which you are having, right? So tell me the number of times as we have grown up, how many times have we gone out to have food? Having food was once in a month, once in 2 weeks, once in a week, maybe. And how many times are we eating now? How many times are we ordering now? Look at Zomato, look at Swiggy. They send you messages as if they're your next door neighbor asking you to come home for food. So that's how it is gone. The reason why we have deterioration is because of the lifestyle which we are having. We have so many parties in the offices. We have samosas coming. We have bread pakoras coming. We have all with coke running, machines running. It's all as if they're there to be taken at it. So we must know what is right. Just because the thing is there, just because it is free of cost, just because you don't have to pay for it, that does not mean you have to eat it, right? You still can stick on to it. Once in a while, if you feel like having it, please have it. Otherwise, stick on to what is right for you. Okay. So Sai Kirti has said, need to work on my gut health for frequent headaches, fatigue, eyesight, sciatica, body heat. Yes, definitely, I agree. A lot of problems have got to do with the GI system itself. But what I suggest to you is, since you have mentioned a lot of problems, you get in touch with the physician or the concerned doctor and ensure that you're taking care of that so that you don't have an issue. It's very difficult for me to explain into particular thing, but yes, the practices healthy which I have discussed with you, try to do, stay close to that. It will help you. Mahesh asked me how to improve digestive capacity of liver and cure fatty acid liver. Like I've told you, reduce your fatty intake, good exercise, good sleep, less stress, reduce the consumption of alcohol, quit smoking. You are going to be there. How to avoid GERD and improve metabolization after hemorrhoids. They're all different. So hemorrhoid doesn't has no role with your metabolism. Hemorrhoids is a surgery which is done for the back end of the GI system. So it has no direct role in hemorrhoids. But yes, if you're asking me, the reason why you get hemorrhoids is constipation. Constipation is a big topic in itself. So what I suggest you is to avoid constipation. Again, drink adequate water and drink plenty of vegetables, plenty of fruits, and go less on maida-based food. Eat in frequent small quantities. Avoid large meals. This would be the best. Same thing holds for GERD. The only thing which I tell is small space meals and avoid sleeping immediately after a meal because that can cause more symptoms. Avoid carbonated drinks, avoid really spicy oil food, and stuffing too much into your stomach. That also helps on avoiding. Otherwise, you need a medical treatment for the same. Signs of an unhealthy health, I told you, poor health in itself. Antibiotics do have a role on affecting the gut health. That's why some of them give a probiotic along with that. What I suggest to you is do not abuse antibiotics. Because you have a fever, you take an antibiotic. Unless and until you have a proven infection, unless and until that proven infection has a bacteria involved, and unless and until that bacteria is effective by tests like either urine or a blood culture or a pus culture to that particular, do not abuse with antibiotics, because we get antibiotics over the counter does not mean you take it. Okay. Healthy lifestyle, exercise, small frequent meals, reduce stress, cut down on alcohol. Again, I'm told this is very, 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 very important. And it is important for overall health because, like I told you, gut or GI system is the powerhouse of the body. If your powerhouse is down, how do you improve? How do you go about it? It's difficult. So again, Monica asked me a very interesting question and a quite visible one while she's saying ki how to maintain a healthy lifestyle while working in night shifts. Can you suggest any food or healthy diet for pregnancy girls? Now, let me tell you, Monica, very honestly, what happens when you do a healthy lifestyle? Na? Because the entire world is having a morning to evening shift, and you are one of the few people who are in night to, night shifts. What you tend to do is you tend to adjust your lifestyle according to others. That's the first and foremost wrong thing which you do. What you need to understand is yours is a complete day cycle. So you are sleeping when others are, doing their work. So during the day, you need to sleep, just like you would be otherwise sleeping on a day shift at night. At night, you need to, work and eat the same way. Like if you're having breakfast at 8 o'clock in the morning, you have breakfast at 8 o'clock in the night. The next meal should be at 11 o'clock in the night. The next meal should be at 2 a.m. in the night. The next meal should be at 5 a.m. in the night. And it should not be like, I'm having my breakfast and going back to sleep. That's where you get, mistaken. You should absolutely lead your life as if you are leading a day life. And just that, suppose let's say you're sitting in a, room where there's no sunlight. How do you know what is 8 a.m. or what is 8 p.m., right? So you just need to follow thinking that it is all in your mind. So follow it in the right way, eat in the right way, you will not have any problem. So that is the only way you can maintain a healthy lifestyle. What we tend to do is we tend to sleep only 3 to 4 hours so that we are awake by the time the kids come home and you are there to take care of the kids, your family, you have to go out, do that, to attend a party, everything. So you are basically curtailing your hours, your, sleep, and then you are bound to have your health issues. Again, the same thing stays as a food or a healthy diet for pregnant ladies. There is no difference because there's nothing that is changed for a pregnant lady. All these food are very good, healthy outside. What key nutrition should be prioritized to keep our gut healthy and functioning? I told you the same food which you have mentioned to you. It is the best way to do that. Follow Mediterranean diet. It will help you right through. And going for this different keto diets or going for this intermittent fasting really doesn't help. Now, how is gut health connected to the cardiovascular system? Right. Healthy body stays in a healthy mind or healthy eating patterns, right? So that is how a gut health is involved in the cardiovascular system. You eat junk, you eat all fatty food, your fat is going to cause a lot of problem to your cardiovascular. Again, the food which I have mentioned to you has a lot. And stenting, same thing goes. Let me tell you something about high cholesterol. So whatever amount of cholesterol is only the part of it which gets taken away in the body. So just because you cut down on cholesterol, it is very difficult. So you need to have your medications also. So that is how you take care of your thing. Okay. Next, how to maintain gut health in babies 1 to 5 years. See, 1 to 5 years is a very, 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 very precarious age. Most of the time, they don't need any processed foods. So what you're eating at home, 1 year late afterwards, they can eat up to 5 years and way beyond that. So whatever food you're eating, that is what they eat. Now, this is the right age for you to ensure that you're eating right so that they eat right. So have dinner together as a family, that helps. And ensure you are eating the same food what they are eating. If they see you eating carrots, they will eat carrots. If they are seeing you eat fried food, they will eat pizzas, burgers, and fried food also. So if you are eating a proper meal, proper diet, you are having your fruits, they will also do it. That is the best way to inculcate the thing. So Avinash has messaged that he is suffering from acid reflux. I've told you how the acid reflux goes. It will help you. If it doesn't help you with the diet pattern, follow us for a visit and we'll help you around with that. How does protein supplements take the gut? See, protein has various. You must understand this is artificial processed proteins. They are not the regular proteins that you get from your food which you intake. And so these are artificially processed with a lot of chemicals and all. So they affect gut in various ways. They can cause gut irritation. They can cause loose stools. They can cause gut inflammation. It's not a great idea. See, sometimes when a person is down, let's say post chemotherapy or malignancy or some condition where he recovers, he cannot eat food properly. He needs that food. Definitely, it has a role. But just to build your body doesn't make any sense. So refrain from it as much as possible and let the use be medical rather than anything else. So how to resolve IBS and quick home ready? For emptying bowel. So let me be very honest with you, Anik. What happens is, if you eat a very balanced diet and if you reduce, cut down on maida-based food or the food which irritates your stomach, you should be just fine. Drinking adequate waters. Now again, to empty bowels, I told you the single most reason. See, you don't eat everything and the same food every day at the same time every day and so many days. You have a different pattern of eating. Each day you change. And how do you expect your GI system to work in the same way that, if I'm eating this today, tomorrow morning, 8 o'clock, I should pass stools? No, it doesn't happen. Give your body adequate time, give your body adequate time for it to get to it. When it wants to get it out, it will definitely get it out, even if you want to stop it. So don't worry about it. The only thing is the quality that can be improved by drinking water and adequate, fruits and vegetables. And still, if you need, you can take some supplements in terms of laxatives. I want to increase my weight, so suggest me a basic diet plan. Sandeep, what I would advise you is don't go for this junk food, just oily food to increase your weight. What I suggest you is a good weight training. Increase your protein in your diet. That is the best way to increase your weight. If your muscle mass increases, your weight will also increase, and that will look good for you, and that is healthy for you. Don't go for fat to improve your weight. Yes, the fat is also required in that, so eat in that way. Rajesh says my LFTs are okay, but I still feel often bloating after eating. I'm vegetarian. Is a balanced food of food. Vegetarian gives me more bloated. What should I do? So Rajesh, what I suggest to you is just because LFT is normal, it doesn't mean your GI system is normal. There could be other factors also. Keep a food diary. What I mean a food diary is write down everything that you have eaten on that day and particular day and see. Keep doing it for a month and write down how you're feeling each day. You will get to an understanding at the end of the month that certain food which you have eaten have actually caused you more bloating than anything. Since you're already eating a lot of fruits, vegetables, what I suggest to you is see the pattern how it goes. Whether this fruit or this vegetable cooked in this way has caused you a problem, whether the other way it has cooked has caused you no problem. So you can go about it and you can see how it helps you. Gantavya has asked, can IBS cure itself? Answer is no, IBS cannot cure itself. We need to find out what exactly is causing it and how bad is it, whether it can be cured with medicines or with the change in diet lifestyle. That only a good GI doctor can only do it for you. Is eating harmful rice harmful life? And answer is absolutely no. Eating rice is not harmful for health at all because, like I told you, 1/4 of the plate should be filled with carbohydrates. That is where rice comes in. You should know what is right for you and you should see how you can go about it. That is how we go it, and that is how you should eat about it. It should not be only rice, but definitely rice is not harmful for health at all. So don't think it is there. So, if you feel rice causes you bloating, avoid it. Try different rices. You have parboiled rice, you have brown rice, you have, the regular rice. So see what suits you, how it goes about it, and you can go with it. Can we take rice and roti together? Yeah, there's no harm for it. So let's say this South Indian food, when we talk of more rice based and North Indian food is, wheat based, more or so, right? So having a combination of is it not wrong at all. So eat in moderation, eat in a good way. There's nothing wrong. Both are, the carbohydrates. So if you want it, reduce the amount and then you can go. Okay. If you don't have any more questions, we can end our session today. Thank you, everybody, for being there with me for this one. I hope this session has got some insight into the problems that you're looking. I hope you have something to know about your own health and how you can change them for a healthy living and a lifestyle. For any more questions or any more personal thing, you can always visit us. I'm there at Fortis Hospital, Vasant Kunj. So you can contact either me directly or you can contact through, Arjun, who will help you down with your further queries. If you have anything, you can send it across. We will be happy to answer you. Thank you all. Thank you for being there. Thank you for the good evening. Okay. Have a great day, everyone. Thank you once again. Take care.